over 3 years ago, I had issues with my ear,
Yeah.
and it wasn't going away, and so we felt it could have been a tooth issue.
Mhm.
I had a fistula, and when they reviewed that, it was a cracked root. So that tooth had to be removed orally. And since that time, not only am I still having some ear issues, I'm having jaw pain and pain where they put the bridge.
Right. So they
Like
replaced the missing
spasms.
tooth with a bridge,
Right, and
and shortly thereafter, you started having muscle spasms.
spasms here and spasms here.
Right.
And it went on for 3 years. I think I've visited 13 different health professionals
Yeah.
over those 3 years, and finally, my dentist, who did not think it was TMJ ever, because I hurt so much, put a bridge or a splint
Mhm.
bite guard on my lower teeth, and that helped relieve some of the pain.
So you had a little bit of resolution.
Right, but it's not perfect, and I don't want to wear that bite guard.
Right.
It's uncomfortable to work in,
Right.
and I got to a point that I thought it was making me digress.
So it helped initially.
It helped, but then I
hurt.
started having other issues.
Do you get headaches?
I have headaches back in my neck.
Okay.
And then up in here.
Do you ever notice sticking your tongue between your teeth?
Oh yes, yes.
It's like a given.
In fact, before I got the bite guard, I would stick the tongue between, and I would even sit on my couch and do this to keep from
touching.
Yeah.
Yeah.
And I was just doing that on just
Did it
ways.
help a little bit?
Yes, it did.
Yeah.
It did.
But then you went. Let's say you got hungry, had a snack, and ate, and then it hurt again.
Yes.
Right.
Yes, and mine. A lot of TMJ people think you clench at night, and I was different in that I would say, no, I wake up feeling pretty good and relaxed, and as the day progressed,
you got worse.
I got worse.
Okay.
And I was clenching because I was hurting, and it was spasming, and it cycled.
Right. Do you have trouble with like iced tea, cold things?
Yes, and I didn't realize that.
Mm-hmm.
I had just that wasn't an issue because the spasming was more of an issue.
But since we've asked
you've asked me on the questionnaire,
yeah,
I realized that I drink my diet soda through a straw, and I don't. And when I brush my teeth,
you warm it up.
I use warm water, and I just had no clue that cold was so sensitive.
Yeah, cold is oftentimes associated with TMD issues.
And see, I had no clue. I thought it was, I'm 55. I thought enamel's wearing away, and I'm just getting old. And
that's what most dentists think. Yeah, the reality is a lot of times it's not that.
I'm using Sensodyne, and
I
didn't realize it, but I was using Sensodyne.
You don't need to use Sensodyne after today, typically.
Okay.
Believe it or not. Have they ever given you muscle relaxants?
Yes, I take. I went to the chiropractor. I had massage therapy up in here, and I have been on 2 or 3 different muscle relaxers. Right now, I'm taking one every night. I think it's called Soma.
Okay, and has it helped?
Yeah, I really think it has. And then they've also given me something for more like a fibromyalgia pain.
Yeah, because they can't figure it out.
Right. I was on 3,500 milligrams of Neurontin because in my 13.
And a neurologist gave you that, right?
Right.
And you've seen the ENTs, the neurologists, the chiropractors, the dentists, the physicians,
Yes, I've seen.
all.
I've been to Barnes in St. Louis, great facility.
Yeah.
But they had no clue. They were just taking me from one
oral surgeon to ENT.
Right, to neurologists, and nobody had an answer.
Yeah.
And finally, I kind of laughed when my dentist, my local dentist, said, well, I don't think it's TMJ, but I'm going to fit you to a bite guard, because he could see I was in pain.
Sure.
I'm much better now. At that point, I was just miserable. I did miss work, but I'd go home every night.
But again, it was not.
And be on the couch on a heating pad.
Right. It wasn't full resolution. It was just a palliative thing.
No. It
helped some.
It helps some.
Right.
But if there's something that can be done to help it even better, I'm going to pursue it.
Of course.
Now clench hard and relax and open and clench hard and open and relax.
Yeah, it's an angry muscle. This guy right here is very upset. Unusually so. I mean, I usually don't see numbers that high. Other way and open. Thank you. Oh yeah. Running right off that bridge. Yeah, this is awesome.
So I didn't need counseling. Some doctors suggested maybe I need to.
Yeah. Yeah, you need counseling. You're crazy. Yeah. They like to attribute it to psychological reasons, and that you're and then fibromyalgia, some of them, because it's a catch-all, they don't know what it is. What's happening is if you bite down, I can see that in 3,000 of a second increments, okay?
Okay.
So there's a little red line, and then there's this little kite thing, an icon. And so I'm watching 3, 6, 9, 12, 15 nanoseconds. And every time I hit this button, it's 3 nanoseconds. And I watch the teeth come together over time, what percentage of force is happening, and I watch a coincident and absolutely slaved EMG response. In other words, I can watch the muscle on the opposite side. So every time I hit the button, things change.
Okay.
So you're swinging off to your left, but then you're banging off your bridge on your right back. So all of a sudden this trail of breadcrumbs is running backwards, and that muscle is hyperfunctioning. Your right temporalis, it shouldn't be firing. You're going left. Your left temporalis should be firing, not your right. He should be shut down and idling, but he's not. He's idling and he gets like this. It's almost like instead of 800 RPMs on your tachometer on the car, it's like 12, 8, 14, 8. But he's supposed to be idling. Something's wrong with your car. So because that engine is always like hyper, does it make sense? You go to the mechanic. Would it surprise you if you said your timing's off? Something's not right with the machine. Makes sense, right?
Yeah.
That's exactly what's going on here in the living system. So. When I palpate up here, is that sore? When I go up here, is that sore?
Yeah, it's a little.
A little bit? Bite home really hard. Rake off and open. Huh?
That seemed to be easier to do that time.
Yep, should be. Subjectively, it feels
Oh, yeah, much better.
good.
Feels just, even if you take the spasms out,
Yeah.
just how it feels in my mouth.
Locks down really easy now, doesn't it?
Yeah.
Like has a natural place
Yeah.
to go home.
Yeah.
Yeah. Left side done.
I never did feel the bridge felt right,
The bridge threw you in a spasm.
but
You had other issues too. You
Other-
got another crown over here that was off. Your bridge primarily. Your canine, the way it's not able to do its job quite right.
Yeah.
So I added a little bit to it to make it catch
Good.
better. It's not ideal. Ideal world, you'd have to get braces to straighten it. Then I would do this over again.
yeah.
But this is practical what we're doing right now.
I get to put away the heating pad at night. And the icy hot.
And the Sensodyne.
Yeah, the Sensodyne.
This is all about dental work gone awry. And in the traditional office, it's good enough.
Yeah.
But some people are more susceptible than others, relative to like a tired muscle. When your muscle gets tired, it's really sore for a couple of days. Well, imagine if you never gave that muscle a break and you kept working it out. That's what you've been doing for 3+ years.
Yeah.
So that lactic acid, that toxic crud that comes out of the anaerobic, cycles to produce energy, it builds up and it's so intense. Okay, so because the muscle's always firing, the teeth are hypersensitive because there's like tension and torque and stress put on them, and they're neurologically connected to the brain, and they're screaming to the brain, "You're going to break me." That's what it's about.
Yeah.
So when you take that away, and we've already done that, you're losing that extra muscle, and we're only 25 minutes into this. All of a sudden, teeth stop screaming to the brain about the cool stuff.
Yeah. Yeah, that's good.
Is it like gone now?
Yeah.
How's this side?
This side's good.
So they're both about the same. Both
Yeah.
those muscles,
They've
just a
settled
finger.
down.
It's not tender.
Yeah.
Feels great. Okay.
They've settled down.
Okay. How's your face feel?
Good.
Describe to me. What's it feel like?
Relaxed.
Yeah.
Relaxed.
How about your neck?
It's good.
Does it feel any different? It may not.
Actually, this side feels good. This side just a little tender, but
A little better.
yeah. Oh, it's a lot better.
Yeah.
A lot better.
Neck muscles are accessory muscles of mastication. So they kind of, when muscles get thrown out of whack up here, they're helping us
Yeah.
chew and stuff and talk. You know, one guy doesn't have enough because something's out of whack. One guy's getting tired, so the other guy, even though his function isn't to really do that,
He's
starts contributing. So the neck's been trying to contribute to the deficiency up here, theoretically.
yeah.
And now all of a sudden, he's relaxed up here. He's doing his job well now, and he can just take a break.
Yeah, it's not my. I'm just relaxed.
Yeah. Little,
Amazing.
Some people feel even sleepy.
Yeah, I
Yeah. Yeah. let
probably
me-
sleep on the way home.
Yeah. Right. Okay. Let me. There's
Okay.
ice in there. 0
No
to 10.
problem. 0.
0.
That is amazing because I couldn't stand ice water.
An hour ago.
Yeah,
An hour ago, what was that? You said a
it was a 6.
6 out of 10.
Yeah,
10's horrible.
yeah.
And now it's a
It's 0.
0.
That is amazing. It's amazing.
Hypersensitive teeth are a sign of muscular TMD issues. Your muscular TMD issues are fixed.
Yeah,
Your hypersensitivity's gone away.
and it's not my enamel.
Not the sensitive eye.